My name is Hamza Anda. I'm a PA student at South University, and today I'm going to talk to you guys at Striker about sleep, the importance of sleep, the role of sleep, and how sleep affects our daily lives. And hopefully, by the end of the presentation, we can discuss how we can take actions and measures to improve our sleep and the detriments that insufficient sleep can have on us. I wish I could give you guys this presentation in person, but at the end of July I've been sick, and I've kind of been sick on and off for the past 3 to 4 weeks. So obviously I don't want to get anyone sick, so that's why I'm going to be doing this virtual presentation with you guys. So let us get started. So sleep. I'm assuming you guys like sleep, you guys don't like sleep, but regardless, we all know about sleep, right? So, again, this project, we're just going to be talking about sleep. With the rise of smartphones and blue lights, adults are getting less sleep, and this less sleep is making us less active, results in all sorts of detriments to our health and our cognition. And you may ask, Hamza, you said you go to PA school at South University. What is a PA? Well, as a PA, a physician assistant, you can do many similar things as an actual physician. You can see a patient, you can treat a patient, you can diagnose a patient, you can prescribe medications. There are limitations, though, in that you are limited under the scope and the supervision under the physician that you practice, and you are always overseen by a physician. So let us get back to the topic. Sleep. So we're going to start taking a sleep health quiz. And this quiz, it breaks us down into 3 categories. It breaks us down into whether our sleep is in the ideal category, whether it's in the moderately diminished category, or whether it is poor sleep category. Moreover, this is going to tell us whether or not there's some sort of sleep apnea going on, insomnia, RLS, or periodic limb movement disorder. So with the first question, I want you guys to just be honest with yourselves and just think to yourselves that you want to answer these questions honestly. So just add up the points to the right towards the red, and let's get started. So question 1. On average, how many hours of sleep do you get each night? 0 to 3, 4 to 6, 7 to 9, or greater than 9 hours. So give yourself the assigned number of points and just keep track of all of those points as we go per question. Question 2. On average, how many days a week would you say you wake up feeling refreshed and rested? So again, just add up these points. Obviously, I know our scores will be thrown off since you guys work these crazy 10-12 hour shifts 6 days a week, but hey, let's just try for it. Question 3, straightforward. Do you have any difficulty falling asleep? Question 4, again, very straightforward. Do you have difficulty staying asleep? Different from question 3 where it's falling asleep, this is staying asleep. Question 5, during the day, do you find yourself excessively sleepy and or lacking energy? Simple yes or no question. This question can be a little tricky in that you might think, yes, I find myself sleepy, but that's without coffee. And you might think to yourself that with coffee or some sort of caffeine stimulant such as Monster or Red Bull, you'll have energy. I just want you to answer it without the stimulant in mind. So without any stimulants, do you find yourself excessively sleepy during the day, or do you find yourself lacking energy throughout the day? Yes or no? Question 6. Do you ever fall asleep while driving, in meetings, reading, TV? 7. Concentration problems, memory issues. 8. Sleepwalking or nightmares more than once a week. 9. Do you snore? Does your wife hate you because you snore? Question 10. Do you kick in your sleep? Does your wife hate you because you kick in your sleep? Chances are, if you answered yes to one of these, oof, you'd probably have a pretty high score on this. So let's interpret our scores. 0 to 6, 7 to 12, 13 to 18, and 19 plus. Realistically, none of us are probably in the 0 to 6 category. If you are, then hey, tell me where you're working because I want to work there. Because I guarantee you, none of us are working at the location you're working if you're 0 to 6. If you're in 0 to 6 right now, you don't even need this meeting. That's how insanely awesome 0 to 6 is because you have the lowest risk of burnout in any single profession. Realistically, most of us fall over the 7 category. And when I was working at Striker, and I'm sure many of you over here at Striker as well, probably fall into the 13 plus category and even the 19 plus category as well, where our sleep health is extremely diminished. Now, what happens when our sleep health is extremely diminished? It can lead to some negative consequences, which is basically the gist of this presentation. So this was a sleep hygiene assessment, and now we're going to be talking about the topic, adults who do not get sufficient sleep. So just a background, in the United States in total, sufficient sleep is defined as around 7 hours or more every single night. And only 67% of the adults in the US get around 7 hours of sleep or more every single night. And now when you look at South Florida, around 65% of these adults get sufficient sleep at night. And then when you take, I guess, the opposite of it a little bit, when you start looking specifically at the Tri-State County, that breaks down to around 62% of adults, or rather 62% of adults getting the 7 hours or more sleep a night. So that puts us at around 38% sleep deficiency, which is not super ideal. And that 38% is actually higher in corporate America because the 38% is diluted by other factors. So 38% might not seem a lot, but when you examine corporate America, although I cannot find the statistics, I guarantee you that it is much, much higher than 38%. So, obviously, we know burnout is bad. What happens when you have burnout? It leads to negative outcomes, negative health decisions, side effects, decrease in productivity. When you have a decrease in productivity, you have a decrease in money. When you have a decreased financial lifestyle, it causes financial strain on your lifestyle, decrease in enjoyment in life, decrease in pleasure in life, decrease in providing for a family. Can have many negative consequences, as we all know. So some questions to think about as we go through this presentation. What do you think insufficient sleep is? We just briefly talked about the definition of insufficient sleep, but it's always good just to ponder in your head what insufficient sleep is and how many hours this is, and the negative impacts that insufficient sleep can have on our everyday lives. So let's talk about the detriments. So obesity. We all know obesity is very common in the United States. In fact, when you ask someone in Europe, the first thing about the United States, they'll always say, oh, everyone from the US, they're super fat. And they're not wrong. Well, where is this fatness coming from? Is this fatness coming from our foods? Possibly. But are there any other factors that contribute to people being fat? Yes, as we know, being inactive, not exercising. But surprisingly, there are other factors as well, and insufficient sleep may play a role in being fat, in obesity. So as we see over here, literature suggests that not a lot of sleep causes mental and metabolic dysfunctions in our body. So individuals who lack sleep, they suffer from depression. And when people suffer from depression, you sometimes see people overeat as a means to cope with this depression. And obviously, as we know, overeating can lead to obesity. So as we see in the second study, it states that adults who were in a 14 to 15 day hour or 14 to 15 day study of insufficient sleep, we found that insufficient sleep was found to increase total daily energy expenditure by 5%, energy intake at night. So you might be thinking, what does that mean, right? However, was an excess of energy needed in order to maintain or lose energy balance? So basically, what this is saying is that when people sleep more, at least in this study, it's saying that they expend more energy. So you might be thinking, Hamza, isn't this quite the opposite of what you're saying? It sounds like it, right? You might be reading this right here, and you might say, ha, I got you. People burn 5% more calories, so they shouldn't be gaining weight. Rather, they should be losing weight, right? The study's right here. It's clear as day. However, what does the study lack? Does anyone want to tell me what is a limitation with the study? It's something we just discussed a little bit earlier. Sure, although individuals they burn a little more energy by 5%. If you have insufficient sleep, if you're only sleeping for 5 to 6 hours, right? So you're awake 20, 19 to 20 hours a day, and you are depressed, what are you doing in those extra 2, 3, 4 hours compared to someone who's sleeping? You're probably eating. You're probably having a late night snack. A typical adult eats anywhere from 2,000 to 2,500 calories a day. 5% of that isn't too much. Maybe 100, 200 calories. My math isn't all that good. But a bag of Cheetos, a bag of chips, excess of 150 calories. And you're probably eating more if you're depressed. So sure, granted, 5% energy expenditure increase when you're not sleeping, all fine and dandy. But in reality, staying awake those few extra hours causes people to get fat because people are depressed when they sleep less and people eat more when they sleep less. So it's a little misleading. However, as we see, it does correlate to an increase in obesity. And then we can see how lack of sleep plays a result in high blood pressure. So there was another study that examined 5,500 individuals sleeping less than 6 hours per night, and they found that these individuals, after everything was correlated, had a two-thirds greater chance of having high blood pressure than other individuals sleeping around 7 to 8 hours a night. The study further talks about the study further goes on to talk about how this is associated with metabolic syndrome and how sleep deprivation adults they have an increase in tumor necrosis factor alpha. So this is a mediator in inflammation processes. As we know, as we have more inflammation, not the best for ourselves. But is there anything other than hypertension? Is there any other cardiovascular problems that may occur with insufficient sleep health? And we have to realize that answer is very astoundingly yes. So in adults with heart failure, there was a study that was done, and it found that with poor sleep in patients with heart failure, it's actually associated with a worsening of heart failure. Now, obviously, you might think to yourself, oh, well, sky is blue, grass is green, very much expected. However, that's when you think about it logically, right? These are one of the very few studies that actually prove that, yes, very few sleep actually correlates to something that is detrimental. So, if you have heart failure, you should probably be sleeping a little more. Also, if you have heart failure, probably not advised that you're working 10 to 12 hours a day. But I digress. So, third point, insufficient sleep and cognitive decline. So, you're probably reading this over here and you're like, Hamza, that's way too many words for me. What's CAMP, right? What's protein kinase? What's PD4 inhibitors? What does all of this mean? What does Alzheimer's mean? What does tau mean? Basically, all this is saying is that sleep deprivation it plays a role in a pathway in our bodies which decrease our memory. So CAMP is a secondary messenger in protein kinase A, and then basically what it's saying is that the secondary messenger, which relays to the protein, which forms our synaptic plasticity, so which helps with memory association, is decreased with sleep deprivation. And then it's saying basically it leads to a decrease in memory. Moreover, sleep deprivation, changes in brain and cognition, changes in brain matter. There was a study that talked about how sleep loss and untreated sleep disorders influence the basic patterns of our behavior and how it also affects our family health and interpersonal relationships. The study found that the lack of sleep, obviously, as we know, decreases productivity and increases the chances of things happening like motor vehicle crashes. The odds of being a short sleeper, such as people who sleep less than 7 hours a night, have a significantly increased risk in the past 30 years of these problems, such as decrease in memory, such as motor vehicle accidents, such as negative things, as we just talked about, negative interpersonal relationships due to the lack of sleep. So another study that specifically talked about brain matter was there was one study which found that a deprivation of sleep was associated with widespread gray matter volume changes in something called your thalamus, cerebellum, insula, and parietal cortex. You're probably just hearing all of these words and you're thinking, that doesn't make any sense. How does this apply to me as an individual? Well, it's actually pretty important because what these areas of your brain are responsible for are things that are actually pretty vital. Without your cerebellum, you probably not would not be in the best state. Cerebellum is necessary for basic survival mechanisms. It's necessary for your vitals. And acute sleep deprivation is associated with atrophy of these areas, and as deprivation prolongs, more areas are shown to reduce in brain volume. Now, finally, the most important point that I want to touch on, if you want to ignore everything that I've said during the presentation, this is one thing I want you to focus on. Something that I think may impact us all long term. A chronic lack of sleep may worsen Alzheimer's and associated memory loss. You might think to yourself, well, this says worsens Alzheimer's. If we don't have Alzheimer's, does this really affect us? And this is when you have to take a step back and realize it may still affect us. Because in healthy brains, when neurons release tau protein, it normally gets cleared away during excessive sleep, or rather during sufficient sleep at night. However, when we sleep deprived, the tau protein cannot be fully cleared away. And moreover, the study went on to find that if you have constant sleep deprivation for a few days, trying to catch up on sleep on a Saturday or Sunday by sleeping in for 12 hours is still not enough to clear away that buildup of excess over the past 5 days. And the study finds that the excess in protein of tau, which leads to the neurofibrillary tangles, is what we see in brains with Alzheimer's. So this is something that is pretty important for all of us because we might think to ourselves we can catch up with our sleep, but in reality, there isn't much sleep catch up because if you're sleeping 4 or 5 hours a night, you're building up a lot of that protein. And then if you try catching up on Saturday and Sunday, unfortunately, as this study suggests, that just may not cut it for us. But what else can happen if we don't have enough sleep? Chernobyl 2.0? Possibly. It's very possible. So there was the CDC that stated itself that insufficient sleep is a public health problem. The CDC found that sleep-related disorders have actually been linked to major catastrophes in the past few years and in the past few decades. One of the major ones that we remember from 2000s was the Exxon oil spill, which leaked all over the oceans. I'm sure you all remember the commercials about that. And then the Space Shuttle Challenger incident. I'm sure you all remember that. And then even the Chernobyl nuclear explosion. Some say that that was also linked, and it could have been prevented by people who paid more attention. But the reason that more attention was not paid to the faulty reactors and to everything was because people are sleep deprived. When they're sleep deprived, they're not able to make these good decisions. It's linked to an increase in mistakes, linked to a decrease in productivity. So by having an increase in risk, especially in a field where we're making uh, 3D orthopedic systems, especially since we're making joints and we're making customizable joints for surgeons for surgery, having those little mistakes probably not the best thing, especially at Stryker when we're making those things to treat patients for surgery. Not something we want to deal with, right? So I'm not saying let's strive for 9, 10 hours of sleep. Realistically, that's not possible. That's not possible with our work schedules. We can't just tell the managers, we can't just say, hey, Anthony, hey, Mike, hey, Keeks, let's cut out the 12-hour days. Not possible, right? In reality, we probably have to at least start increasing slowly. Go up from 5 hours to 6 hours. Go up from 6 hours to 7 hours. Just a gradual changes, right? So how this relates to us all, like I was just previously stating, it seems improbable to cut back on work hours, but we can increase and improve our sleep hygiene by decreasing the blue light that we're getting from our phones and incorporating a sleep alarm. So by decreasing the blue light, which is artificial sunlight, this will help us fall asleep easier. Your phone and your screens and all of these technologies nowadays, they release this blue light, so a specific wavelength that is emitted which mimics the sun. It's an artificial sunlight to tell your brain, hey, don't go to sleep, stay awake. So if you're watching TV, when you come home, it's 1 a.m., or you're watching Netflix, and then you notice you can't fall asleep for 30 minutes to an hour afterwards, it's due to this blue light. Now, I'm not saying let's cut out Netflix. I'm not saying let's cut out the television or whatnot. Rather, there are blue light glasses out there that you can just wear at night to cut out the blue light. You have some cool blue light glasses from Amazon. They cost 10, 15 bucks. Very worthwhile investment. Just wear those and your eyes will be able to filter out the blue light with these blue light glasses, and you can go to sleep much easier. You won't have to spend time laying, twisting, and turning around in bed. And then what else can we do? We can have a sleep alarm, right? So a sleep alarm, we can have sleep timers. We can also have app restrictions. Let's say you get home, you're tired, but you want to scroll on TikTok. You lose time with TikTok, sometimes 30 minutes will become an hour, sometimes it becomes 2 hours, whatnot. There are ways you can actually limit the time on your phone. So if you go to settings, screen time, downtime, set your specific hours that you want purest downtime so your phone does not give you any notifications of messages. Go back to screen time, click add limits for app limits, and then add in the specific apps that you want to add that have whatever duration. So let's say you go on TikTok, Facebook, whatnot, just add in those specific applications, and it'll say how many minutes would you like a day. Let's say you put in 30 minutes, so let's say you put in an hour. So after that 1 hour, it will totally shut off the app, and you can't access it until the next day. So this will help you be a little more accountable with your time, and you won't lose track of your time. How else can we improve our sleep hygiene? Well, something called blackout curtains. I'm sure y'all know about them. I'm sure y'all heard about them. Blackout curtains, block the sunlight from coming in. Now, this doesn't relate to a lot of people. This is more so for the people who work overnights, more so for the people who come to work at 11 p.m. and then leave, get home at like 11 a.m. or 12 p.m. This is for you guys. For the rest of us, this doesn't really apply, but for third shifters, amazing. What else is there? White noise. People love white noise. Much better than the white noise you get from TV. You can get white noise from things like rain, from sleep apps. If you just look up on your phone, meditation apps, or you look up sleep sounds, they'll have rain. Rain is naturally shown to help your body sleep. The sounds are very soothing, sounds are very relaxing. You really enjoy it. So, at the end of the day, we're just trying to improve your quality of sleep. Hopefully, we'll have you sleep longer. And why do we want to do this? Because at the end of the day, sleep makes us who we are, right? It helps us stay sharp mentally, helps us stay sharp physically. And why do we care about the way we look? Because at Striker, you're working with a lot of people. You want to make the best impression of yourself, right? You want to make the best person of yourself. When you feel the best, when you look the best, you are the best. When you look amazing, when you don't have the obesity, then you act amazing, you feel amazing, and then you'll strive amazing, you'll be amazing, you'll be able to do all of these feats that you've never done before. Now, granted, this isn't some sort of magic pill, this isn't some snake oil. I'm not trying to sell you guys anything, and I'm not making any big promises as well. I'm not saying that increasing sleep will cure cancer. I'm not saying that if you're 400 pounds right now, that going to sleep will make you drop to 190. No, but rather this will give you energy, and this will hopefully give you motivation to start accomplishing all of those goals in your life, so you can be the bigger and better person of yourself that you always wanted to be. Thank you guys for your time, and I look forward to talking to you guys in person when I feel better. Thank you.